Hello friend, now we are gonna discuss about alcoholism. Alcoholism can be affect not only the life of the alcoholic but the lives of their friends and family. Sometimes an alcoholic can function for years without anyone realizing just how pervasive their illness has become, not only because they may be actively hiding their addiction but also because even in the 21st century, the majority of the American popular remain unaware of the signs, symptoms, and danger of alcoholism. They are introduced with it by friends and around people. First, they occasionally drink. If anything terribly happen in life, then they need to forget their problems and pain. So they continuously drink and addicted to it. They don't have respect in the society, family and people around him hated and neglect him from their environment. Checklist or sign of alcoholic: neglecting responsibility in order to drink, use of alcohol in inappropriate or dangerous situation, mixing alcohol with prescription medication, being arrested for public drunkenness and nuisance, using alcohol as a relaxation or stress aid, avoiding family or friends in order to drink, unwillingness to stop drinking even for short period, uncharacteristic changes in behavior, excessive fatigue, sudden onset of depression, intestinal trouble, heart failure, liver failure. These are the possible sign and checklist for alcohol abuse. It's common signs of addiction. The sign and symptoms of alcohol abuse. There are two basic ways that someone can misuse alcohol. They can either have a behavioral disorder, more commonly known as alcohol abuse. Next, they can have an actually physically dependence on alcohol, which is technical definition of alcoholism. Alcohol abusers typically have the ability to curtail their use of alcohol, but due to whatever external stimuli are driving them to drink, they typically are locked in self-destruction cycle that can frequently lead to full-fledged alcoholism. Long-term danger of alcoholism: heart problems such as cardiomyopathy, alcoholic hepatitis, fibrosis or cirrhosis of liver, pancreatitis, cancer of mouth, esophagus, throat, liver or breast, likelihood of pneumonia or TB. Rehab and treatment at behavioral health. It was with the help of an all-inclusive recovery program to change behavioral health. There is many rehab institutions all over the world helping them to recover. Detoxification. The detoxification process is the initial part of any addiction treatment, and it involves overcoming one of the greatest obstacles of a patient's entire recovery journey, the chemical dependency. Although the pain and stress of detox can be somewhat relieved through some medications and make them feel comfortable as possible, patients are still likely to express a certain level of withdrawal. This is absolutely necessary as mental recovery can begin while the body is still filled with toxins and dependent on alcohol to perform the most basic of functions. Patients undergoing alcohol withdrawal frequently exhibit some of the following symptoms: intestinal distress, migraine headache, hallucination, tremors or heart palpitations, flu-like symptoms, insomnia. Recovery of alcoholism. Through extended behavior therapies and counseling, a patient will learn how to completely change their worldview and eventually reach the point where they can continue on with their life. With the help and support of the family and friends, they can get hope and come out from that and live their life as they want. Alcoholism has been known by a variety of terms. Today it's referred to as alcohol use disorder. It occurs when you drink so much that your body eventually becomes dependent on or addicted to alcohol. When this happens, alcohol becomes the most important thing in your life. People with alcohol use disorder will continue to drink even when drinks cause negative consequences like losing a job or destroying relationships with the people they love. They may know what their alcohol use negatively affects their lives, but it's often not enough to make them stop drinking. Some people may drink alcohol to the point that it causes problems, but they are not physically dependent on alcohol. This used to be referred to as alcohol abuse. What causes it? The cause of alcohol use disorder is still unknown. Alcohol use disorder develops when you drink so much that chemical changes in brain occur. These changes increases the pleasure feelings you get when you drink alcohol. This makes you want to drink more often, even if it is cause harm. Eventually, the pleasurable feeling associated with alcohol use go away and the person with alcohol use disorder will engage in drinking to prevent withdrawal symptoms. These withdrawal symptoms can be quite unpleasant and even dangerous. Alcohol use disorder typically develops gradually over time. It's also known to run in families. What are the risk factors? Although the exact cause of alcohol use disorder is unknown, there are certain factors that may increase your risk for developing this disease. Known risk factors include having more than 15 drinks per week if you are male, more than 12 drinks per week if you are female, more than 5 drinks per day at least once a week, a parent with alcohol use disorder, a mental health problem such as depression, anxiety, or schizophrenia. You may also be a great risk for alcohol use disorder if you are a young adult experiencing peer pressure, have low self-esteem, experience a high level of stress, live in a family or culture where alcohol use is common and accepted, have a close relative with alcohol use disorder. Some symptoms of alcohol use disorder are based on the behaviors and physical outcomes that occurs as a result of alcohol addiction. People with alcohol use disorder may engage in the following behaviors: drinking alone, drinking more to feel the effect of alcohol, becoming violent or angry when asked about their drinking habits, not eating or eating poorly, neglecting personal hygiene, missing work or school because of drinking, being unable to control alcohol intake, making excuses to drink, continuing to drink even when legal, social, or economical problems develop, giving up important social, occupational, or recreational activities because of alcohol use. People with alcohol use disorder may also experience some physical symptoms like alcohol cravings, withdrawal symptoms when not drink, including shaking, nausea, and vomiting, tremors the morning after drink, lapses in memory after a night of drink, illness such as alcoholic ketoacidosis or cirrhosis. Some self-testing methods. Sometimes it can be hard to draw the line between safe alcohol use and misuse of alcohol. Professional diagnosis. Your doctor or healthcare providers can diagnose alcohol use disorder. They will do a physical exam and find it. Drink when you are drunk, drive when you are drunk, have missed work or have lost a job as a result of your drinking, need more alcohol to feel drunk when you drink, have experienced blackouts as a result of your drinkings, have tried to cut back on your drinking but couldn't. Your doctor may also use a questionnaire that assesses alcohol use disorder to help diagnose your condition. Typically, a diagnosis of alcohol use disorder doesn't require any other type of diagnosis test. There is a chance your doctor may also order blood work to check your liver function if you show signs or symptoms of liver disease. Alcohol use disorder can cause serious and lasting damage to your liver. Your liver is responsible for removing toxins from your blood. When you drink too much, your liver has a harder time filtering the alcohol other toxins from your bloodstream. This can lead to liver disease and other complications. Treatment for alcohol use disorder varies, but each method is meant to help you stop drinking altogether. This is called abstinence. Treatment may occur in stages: detoxification or withdrawal to rid your body of alcohol, rehabilitation to learn new copies, skills and behaviors, counseling to address emotional problems that may cause you to drink, support groups including 12 steps programs such as Alcoholics Anonymous, medical treatment for health problems associated with alcohol use disorder, medications to help control addiction. There are a couple of different medications. Naltrexone is used only after someone has detoxed from alcohol. This type of drug works by blocking certain receptors in the brain that are associated with alcoholic high. This type of drug, in combination with the counseling, may help decrease a person's craving for alcohol. Acamprosate is a medicine that can help re-establish the brain original chemicals state before alcohol dependence. This drug should also be combined with therapy. Disulfiram is a drug that causes physical discomfort such as nausea, vomit and headaches anytime the person consumes alcohol. You may need to seek treatment at an inpatient facility if your addiction to alcohol is severe. Their facilities will provide you with 24 hours care as you withdraw from alcohol and recover from your addiction. Once you are well enough to leave, you will need to continue to receive treatment on an outpatient basis. What is the outlook for a person with alcohol use disorder? Recovering from alcohol use disorder is difficult. It will depend on your ability to stop drinking. Many people who seek treatment are able to overcome the addiction. A strong support system is helpful for making a complete recovery. Outlook will always depend on the healthy complications that have developed as a result of your drinking. Alcohol use disorder can severely damage your liver. It can also lead to other healthy complications: bleeding in the gastrointestinal tract, damage to brain cells, cancer in the gastrointestinal tract, dementia, depression, high blood pressure, pancreatitis, nerve damage, change in mental status including Wernicke-Korsakoff syndrome. How to prevent alcohol use disorder? We can prevent alcohol use disorder by limiting your alcohol intake. With the help of the family and friends and surrounding people, anyone can withdraw from the alcohol addiction and alcohol using disorder.